Welcome student, I am Mr. Abhijit Bambre, working as Assistant Professor at Gokhale Education Society's Arts, Commerce and Science College, Jawhar. Today we are going to learn new chapter that is 2.5 Unit 2nd Antiparkinsonism drugs. What is Parkinsonism? Let's move. Parkinsonism, it is a disease named after Dr. James Parkinson, who first described the disease condition called as shaking palsy. Parkinsonism disease is named after Dr. James Parkinson, who described the disease condition or symptoms called as shaking palsy. The disease is caused due to abnormal function of CNS, central nervous system, particularly lower part of the brain. Parkinsonism disease is caused due to abnormal function of central nervous system. The disease mainly causes rigidity in the body part and affect the posture, movement and speech. Means slur speech, slow movement, shuffling, awkward gait, etc. There are three types of Parkinsonism disease. First one, idiopathic paralysis agitans. Then post-cephalitic Parkinsonism. Third one, arteriosclerotic Parkinsonism. Parkinsonism disease are classified into three types, that is idiopathic paralysis agitant. Second one, post-cephalitic Parkinsonism, and third one was arteriosclerotic Parkinsonism. What is idiopathic paralysis agitans? Symptom of idiopathic paralysis agitans is a tremor, rigidity, slowness. Actually, idiopathic paralysis is an primary disease, is an primary Parkinsonism disease. Then second one, post-cephalitic Parkinsonism is post-Parkinsonism disease, is a disease believed to be caused by a viral illness that trigger generation of nerve infection. Third one, arteriosclerotic Parkinsonism, that cause due to several small stroke in the body part of the or small stroke in the part of the brain that receive information about position and movement can cause Parkinsonism. Arteriosclerotic Parkinsonism is caused due to several small stroke in the part of brain. Symptom of arteriosclerotic Parkinsonism are rigidity, slowness, walking with short means shuffling step, speech and memory or thinking problem, etc. Antiparkinsonism drugs, in that, what is Parkinsonism disease? Parkinsonism means paralysis, is a disease. Parkinson disease is named after the Dr. James Parkinson, who first described the disease condition called as shaking palsy, right? Then disease is due to abnormal functioning on CNS, particularly lower part of the brain. There are three types: idiopathic paralysis agitans, second postenocephalic Parkinsonism, third one arteriosclerotic Parkinsonism. Next, there is some symptom of Parkinsonism. That is, first symptom, tremor is most visible symptom. As we know, tremor is most visible symptom of this disease. It occurs at rest and is most common in the hand and arm. As the disease progresses, the tremor may affect more of the body and become a more pronounced. Tremor is the most visible symptom of Parkinsonism disease. It occurs at rest and is most common in the hand and arm. When, as the disease progresses, as the disease is increase, the tremor may affect more of the body or it become a more pronounced. Second, rigidity or muscles stiffness result from a shortening of the muscles. This rigidity causes unstable posture and awkward gait. Awkward gait means a walking abnormalities. Improper walking means awkward gait is due to rigidity or muscle stiffness. It result that individual unable to walk, that those person having Parkinsonism disease having unable to walk, or they having walking abnormalities means awkward gait. Third one, slow movement or bradykinesia. Bradykinesia term is a slow movement. Slow down of the movement associated with the inability to start a movement. It is a third symptom of Parkinsonism disease, means inability to start movement. Means bradykinesia means inability to start a movement, inability to walk, right? Fourth one, due to stiffening of muscles, there will be difficulties in eating and swallowing as well as slur speech. Means speech difficulty, speaking difficulty, slur speech due to stiffening of muscles. There will be difficulty in eating. Those person having Parkinsonism disease, they having eating difficulty and slur speech. Fifth one, in acute condition, the facial muscles freeze, resulting in a mask-like facial expression. A mask-like facial expression is an example of or is a symptom of Parkinsonism disease. There are 5 symptoms of Parkinsonism disease. First, tremor is a most visible symptom. Second, rigidity of muscle stiffness result from a shortening of muscles. It causes awkward gait, means abnormality in walking. Slow down movements means inability to start movement, inability to start walking is called as bradykinesia. Fourth one, due to stiffening of muscle, there will be eating difficulties and slur speech or speaking difficulties. Then, in fifth, acute condition of the Parkinsonism disease, resulting if mask-like facial expression is a symptom of Parkinsonism disease. Next, chemotherapy. The anti-Parkinsonism drugs cannot be altered or chemotherapy. The drugs, what is anti-Parkinsonism drugs? The drug used to treatment of Parkinsonism disease, right? The drugs which are used to treatment Parkinsonism disease and elevate the symptom are called as anti-Parkinsonism drugs. The drug used to treatment of Parkinsonism disease and elevate the symptom, right, are called as anti-Parkinsonism disease. Anti-Parkinsonism drugs. Anti-Parkinsonism drugs cannot be altered or reverse the change occur in the body due to disease. They cannot alter and reverse the changes, that is rigidity, stiffness, slur speech, awkward gait. They cannot reverse as normal. Anti-Parkinsonism drugs, they cannot alter or reverse the normal state in that particular person having an Parkinsonism disease. Alter or reverse the change occur due in the body due to the Parkinsonism disease. These drugs only diminish the symptom. They diminish the symptom mean and allow the patient to live with minimum difficulty. The drugs, anti-Parkinsonism drugs, where they diminish the symptom, means decrease the symptom and allow the patient to live with minimum difficulties. Parkinsonism is an incurable disease. Parkinsonism paralysis is an incurable disease. Chemotherapy is usually combined with physiotherapy and psychological support they can be used. This drug antagonize the chemical neurotransmitter which are responsible for transmission of impulse and thus block the tremor. Parkinsonism drugs, they antagonize the chemical neurotransmitter which are responsible for transmission of impulse and thus they block the tremor. They antagonize their neurotransmitter, they block the tremor. The disease require prolonged treatment with timely change of the drug and dosage is needed. The treatment on Parkinsonism disease is long time and a drug where change timely and dosage is also changed. Chemotherapy, what is anti-Parkinsonism drugs? Those are drugs which are used to treatment of Parkinsonism disease and alleviate the symptoms are called as anti-Parkinsonism drugs. These drugs are only diminish the symptom. They not cure completely Parkinsonism. Got it? They diminish the symptom and allow the patient to live with a minimum difficulties. So Parkinsonism is an incurable disease. Actually, chemotherapy is used combined with physiotherapy and psychological support. These drugs antagonize the chemical neurotransmitter which are responsible for transmission of impulse, and thus they block the tremor. And anti-Parkinsonism drugs is require prolonged treatment and changes with drugs and doses. Next, Parkinsonism drugs. There are two type of Parkinsonism drugs, that is anticholinergic drugs and dopaminergic drugs. First one is an anticholinergic drugs and second one was dopaminergic drugs. Anticholinergic drugs, these are drugs antagonize the stimulated cholinergic agent that are responsible for controlling routine brain function. Means they stop the cholinergic agent that are responsible for controlling the routine of brain function. Example, atropine, camadrine, parsidol as an example of anticholinergic drugs. Second one is dopaminergic drugs. These drugs are capable of rebuilding the dopamine level. In the central nervous, dopamine is an important neurotransmitter in CNS, in central nervous system, and its depletion causes Parkinson disease. Actually, dopamine is an important neurotransmitter. Second one was dopaminergic drugs. In central nervous system, dopamine is an important neurotransmitter in central nervous system. Its depletion causes Parkinsonism disease. Example, levodopa. Example of anticholinergic agent, that is camadrine and structure of camadrine, and second anticholinergic agent, that is parsidol. Third, dopaminergic agent. Example, levodopa is an alpha amino acid. Actually, when levodopa is administered, it can penetrate the blood-brain barrier. When levodopa is administered with a different dosage form or any dosage form, it can be penetrate blood-brain barrier and get decarboxylated. Here decarboxylation take place, means removal of carbon dioxide to give dopamine. Thus it can be replaced dopamine in the brain which is depleted in the patient having Parkinson disease. Actually, levodopa is administered or levodopa is given to the patient which is goes into decarboxylation to get dopamine, and dopamine replace the dopamine in the brain which is depleted in the patient having Parkinson disease. It also used to control similar neurological symptoms caused by the manganese poisoning. Levodopa is belong to amino acid class of compound. Levodopa is an example of dopaminergic drug. Actually, dopaminergic is an important neurotransmitter, and depletion of dopamine cause Parkinsonism disease. Got it? Thank you.